Question 1. The efficiency study reveals that a patient with significant mobility impairments and a mild cognitive deficit is struggling to participate in community activities due to difficulties with navigation and communication. The DHP is tasked with recommending assistive technology to enhance the patient's independence. Which of the following approaches best aligns with professional standards and regulatory expectations for a disability healthcare professional? Option A. Conduct a comprehensive assessment of the patient's current functional abilities, environmental barriers, and personal goals, and then collaboratively explore and recommend a combination of a lightweight, foldable mobility aid that is easy to transport and a user-friendly communication device with pre-programmed phrases and voice output, ensuring the patient can operate both effectively. Option B. Prioritize the least expensive, basic manual wheelchair and a simple picture exchange communication system, as these are widely available and cost-effective, even if they do not fully address the patient's desire for more spontaneous communication and independent travel. Option C. Recommend the most advanced, voice-activated environmental control unit available on the market, assuming it will provide the patient with the greatest level of independence, without a detailed assessment of their cognitive capacity to manage its complex interface. Option D. Select a sophisticated eye-gaze computer access system based on its technological capabilities, without first evaluating the patient's ability to maintain consistent eye contact or their comfort level with such an interface. The correct answer is A. Conduct a comprehensive assessment of the patient's current functional abilities, environmental barriers, and personal goals, and then collaboratively explore and recommend a combination of a lightweight, foldable mobility aid that is easy to transport and a user-friendly communication device with pre-programmed phrases and voice output, ensuring the patient can operate both effectively. Explanation: this scenario presents a professional challenge because it requires a disability healthcare professional, DHP, to balance the immediate need for functional improvement with the long-term implications of technology adoption, all within the framework of patient autonomy and regulatory compliance. The DHP must consider not only the technical capabilities of assistive technology, but also its integration into the patient's life, the patient's capacity to learn and adapt, and the ethical imperative to provide the most appropriate and beneficial solutions. Careful judgment is required to avoid imposing solutions that may be technically advanced but practically unmanageable or ethically questionable. The correct approach involves a comprehensive assessment of the patient's current functional abilities, environmental context, and personal goals, followed by a collaborative selection of assistive technology that directly addresses identified needs and promotes independence. This approach aligns with the DHP's ethical duty to act in the best interest of the patient and to uphold principles of person-centered care. Regulatory frameworks for DHPs typically emphasize the importance of individualized care plans, informed consent, and the use of evidence-based practices, all of which are embodied in this approach. The focus is on empowering the patient and ensuring the technology serves their specific needs and preferences, rather than simply implementing the most sophisticated option. An incorrect approach that prioritizes the most advanced or feature-rich communication device without a thorough assessment of the patient's cognitive and motor skills for its operation would fail to meet the patient's actual needs. This could lead to frustration, underutilization of the device, and a violation of the ethical principle of beneficence, as the technology would not be beneficial. Furthermore, it could contravene regulatory guidelines that mandate the selection of assistive technology appropriate to the individual's capabilities and environment. Another incorrect approach that focuses solely on the cost-effectiveness of a basic mobility aid, overlooking the patient's expressed desire for greater independence and participation in social activities, would be ethically flawed. While cost is a consideration, it should not override the patient's quality of life and functional goals. This approach would neglect the principle of respect for autonomy and could lead to a suboptimal outcome for the patient, potentially violating regulations that require consideration of the patient's overall well-being and aspirations. A third incorrect approach that involves recommending a computer access method based on the DHP's personal familiarity with it, rather than the patient's specific physical limitations and learning style, would be unprofessional and potentially harmful. This demonstrates a lack of thorough assessment and a failure to prioritize the patient's individual needs. It could lead to the selection of an inappropriate tool, hindering the patient's ability to access information and engage in activities, and would be contrary to regulatory expectations for individualized and evidence-based assistive technology provision. The professional decision-making process for similar situations should involve a systematic, patient-centered approach. This begins with a thorough functional assessment, including an evaluation of the patient's physical, cognitive, and sensory abilities, as well as their environmental context and personal goals. Next, the DHP should engage in shared decision-making with the patient and their support network, exploring various assistive technology options that align with the assessment findings. This exploration should consider the effectiveness, usability, and appropriateness of each option for the individual. Finally, the DHP must document the assessment, the rationale for the chosen technology, and the plan for training and ongoing support, ensuring compliance with all relevant regulations and ethical guidelines. Question 2. System analysis indicates that a disability healthcare professional, DHP, is assessing a patient with a complex cognitive impairment who has previously expressed a desire to refuse a life-sustaining medical treatment. The DHP is aware of the patient's stated wishes, but also recognizes the potential for this decision to lead to a poor prognosis. The DHP must determine the most appropriate course of action in accordance with international human rights law, specifically the UN Convention on the Rights of Persons with Disabilities, CRPD. Which of the following risk assessment approaches best aligns with the DHP's obligations under the CRPD? Option A. Conduct a thorough risk assessment focused on identifying and providing all necessary support mechanisms to enable the patient to make an informed decision about the life-sustaining treatment, respecting their autonomy to the greatest extent possible. Option B. Consult primarily with the patient's family to determine the course of action, as they are most likely to understand and advocate for the patient's best interests in this complex situation. Option C. Immediately initiate proceedings to appoint a substitute decision-maker, as the patient's cognitive impairment suggests an inability to make such a critical medical decision independently. Option D. Prioritize adherence to established institutional protocols for end-of-life care, assuming that these protocols adequately safeguard the rights of individuals with disabilities. The correct answer is A. Conduct a thorough risk assessment focused on identifying and providing all necessary support mechanisms to enable the patient to make an informed decision about the life-sustaining treatment, respecting their autonomy to the greatest extent possible. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a disability healthcare professional, DHP, to balance the immediate needs of a patient with the broader legal and ethical obligations stemming from international human rights law, specifically the UN Convention on the Rights of Persons with Disabilities, CRPD. The DHP must navigate potential conflicts between established clinical protocols and the CRPD emphasis on autonomy, participation, and non-discrimination. The risk lies in either failing to uphold the patient's rights as enshrined in the CRPD, or in misinterpreting and misapplying its principles, potentially leading to suboptimal or even harmful care. Careful judgment is required to ensure that all decisions are patient-centered and legally compliant. Correct approach analysis. The correct approach involves a comprehensive risk assessment that prioritizes the patient's right to self-determination and informed decision-making, as stipulated by Article 12 of the CRPD. This means actively seeking to understand the patient's wishes, preferences, and values, and exploring all available support mechanisms to enable them to make their own decisions. This approach aligns with the CRPD mandate to ensure persons with disabilities enjoy legal capacity on an equal basis with others in all aspects of life. It requires the DHP to engage in open communication, provide information in accessible formats, and involve the patient in developing a care plan that respects their autonomy, even if it differs from conventional approaches. Incorrect approaches analysis. One incorrect approach would be to solely rely on existing institutional policies and procedures without critically evaluating their compatibility with CRPD principles. This fails to acknowledge the CRPD role in shaping and, where necessary, overriding national legislation and institutional practices that may be discriminatory or restrictive. It risks perpetuating systemic barriers to the rights of persons with disabilities. Another incorrect approach would be to assume that because a patient has a disability, their decision-making capacity is inherently compromised, and therefore a substitute decision-maker should be automatically appointed. This directly violates Article 12 of the CRPD, which prohibits arbitrary deprivation of legal capacity and mandates the provision of support to exercise legal capacity. It represents a paternalistic approach that undermines the individual's autonomy. A third incorrect approach would be to defer all decision-making to family members or guardians without ensuring the patient's active participation and consent to the maximum extent possible. While family involvement is often beneficial, the CRPD emphasizes the primary right of the person with the disability to make their own decisions with appropriate support. This approach risks marginalizing the patient's voice and preferences. Professional reasoning. Professionals should adopt a decision-making framework that begins with a thorough understanding of the patient's individual circumstances, including their disability, their support network, and their personal values. This should be followed by a comprehensive review of relevant national laws and the international obligations under the CRPD. The core of the decision-making process should involve open, respectful, and ongoing dialogue with the patient, employing communication strategies that are tailored to their needs. Any proposed interventions or decisions must be assessed against the principles of autonomy, non-discrimination, and full participation, as outlined in the CRPD. When potential conflicts arise, the DHP must advocate for the patient's rights and seek solutions that uphold their dignity and self-determination, consulting with ethics committees or legal counsel if necessary. Question 3. Benchmark analysis indicates that a disability healthcare professional, DHP, is supporting an individual who exhibits frequent aggressive outbursts during personal care routines. The DHP's immediate priority is to ensure the safety of themselves and the individual. Which of the following approaches best aligns with regulatory requirements and ethical best practices for positive behavior support? Option A. Rely solely on verbal de-escalation techniques and hope the behavior subsides over time. Option B. Conduct a thorough functional behavior assessment, FBA, to understand the triggers and purpose of the outbursts, and then develop a behavior intervention plan, BIP, based on the FBA findings. Option C. Immediately implement a plan to physically restrain the individual during personal care to prevent harm. Option D. Introduce immediate punitive measures to discourage the aggressive behavior. The correct answer is C. Immediately implement a plan to physically restrain the individual during personal care to prevent harm. Explanation. This scenario presents a professional challenge because it requires the disability healthcare professional, DHP, to balance the immediate need for safety with the ethical and regulatory imperative to understand the underlying reasons for clients' challenging behavior. Simply suppressing the behavior without a functional assessment risks ineffective interventions, potential harm to the client, and a failure to meet the client's support needs. Careful judgment is required to ensure that interventions are person-centered, evidence-based, and compliant with DHP professional standards. The correct approach involves conducting a comprehensive functional behavior assessment, FBA, to identify the antecedents, behaviors, and consequences, ABCs, of the challenging behavior, and then developing a behavior intervention plan, BIP, that addresses the function of the behavior. This approach is ethically justified by the principles of person-centered care, promoting dignity and autonomy, and is regulatory compliant as it aligns with best practices in disability support that emphasize understanding and addressing the root causes of behavior rather than merely managing symptoms. This systematic process ensures interventions are tailored to the individual's needs and are more likely to be effective and sustainable. An incorrect approach would be to immediately implement restrictive physical interventions without first attempting to understand the behavior's function. This fails to meet the regulatory requirement for least restrictive practices and can be ethically problematic by potentially causing distress or harm without addressing the underlying cause. Another incorrect approach would be to rely solely on verbal redirection without a formal assessment or plan. While verbal redirection can be a component of a BIP, its standalone use without understanding the behavior's function is unlikely to be effective for persistent challenging behaviors and may not meet the DHP's professional obligations for evidence-based practice. A third incorrect approach would be to focus solely on punishment-based strategies. This is ethically unsound, as it can be detrimental to the client's well-being and is generally not considered best practice or compliant with modern disability support frameworks that prioritize positive and proactive interventions. Professionals should approach such situations by prioritizing a thorough FBA. This involves observing the client, gathering information from caregivers and the client themselves, where possible, and analyzing the context of the behavior. Based on the FBA findings, a BIP should be developed collaboratively, incorporating strategies that teach alternative behaviors, modify the environment to prevent triggers, and reinforce positive behaviors. This systematic, person-centered, and evidence-based approach ensures compliance with professional standards and promotes the client's overall well-being. Question 4. Cost-benefit analysis shows that a comprehensive, multidisciplinary approach to chronic pain management, integrating pharmacological, non-pharmacological, and rehabilitative strategies, offers the most sustainable improvement in patient function and quality of life. Considering this, which of the following best reflects the DHP's primary responsibility when developing a treatment plan for a patient presenting with chronic neuropathic and musculoskeletal pain? Option A. Implement a treatment plan based solely on the most recent clinical guidelines for neuropathic pain, irrespective of the patient's specific musculoskeletal pain presentation or functional goals. Option B. Recommend immediate referral to a pain specialist for a definitive diagnosis and management plan, without initiating any preliminary interventions. Option C. Prioritize a holistic treatment plan that addresses the patient's pain, functional limitations, and psychosocial well-being through a combination of evidence-based interventions, with regular reassessment and patient collaboration. Option D. Focus primarily on prescribing opioid analgesics to achieve rapid pain reduction, as this is often the most direct way to alleviate suffering. The correct answer is C. Prioritize a holistic treatment plan that addresses the patient's pain, functional limitations, and psychosocial well-being through a combination of evidence-based interventions, with regular reassessment and patient collaboration. Explanation: this scenario is professionally challenging because it requires balancing the immediate need for pain relief with the long-term implications of treatment, particularly in chronic pain conditions. The DHP must consider not only the patient's subjective experience of pain, but also objective functional improvements and potential risks associated with various management strategies. Adherence to the Disability Healthcare Professional (DHP) regulatory framework is paramount, ensuring that all decisions are evidence-based, patient-centered, and ethically sound, prioritizing patient well-being and safety above all else. The correct approach involves a comprehensive, multidisciplinary assessment and individualized treatment plan. This aligns with best practices in chronic pain management, emphasizing a holistic view of the patient. It requires the DHP to integrate pharmacological, non-pharmacological, and rehabilitative interventions tailored to the specific type of pain, chronic, neuropathic, musculoskeletal, and the patient's overall health status, functional goals, and preferences. This approach is ethically justified by the DHP's duty of care, which mandates providing the highest standard of treatment and promoting patient autonomy. Regulatory guidelines for DHPs typically emphasize evidence-based practice and patient-centered care, which this approach directly supports. An incorrect approach that focuses solely on pharmacological interventions without considering non-pharmacological or rehabilitative options fails to address the multifaceted nature of chronic pain. This can lead to over-reliance on medication, potential for adverse effects, tolerance, and dependence, and may not improve functional capacity. Ethically, this approach neglects the principle of beneficence by not exploring all avenues for patient improvement and potentially causing harm through unmanaged side effects. Regulatory failure occurs if the DHP does not adhere to guidelines promoting comprehensive pain management strategies. Another incorrect approach that prioritizes rapid symptom suppression without a thorough assessment of the underlying causes or functional impact overlooks the chronic nature of the pain. This can result in a superficial treatment that does not address the root issues, leading to persistent disability and reduced quality of life. It violates the DHP's responsibility to promote long-term well-being and functional recovery. Regulatory noncompliance arises from failing to conduct a complete assessment and develop a sustainable management plan. A third incorrect approach that dismisses patient-reported pain as purely psychological without objective evidence of physical pathology, or vice versa, demonstrates a failure to integrate subjective and objective findings. This can lead to misdiagnosis, inappropriate treatment, and a breakdown in the therapeutic relationship. Ethically, it disrespects the patient's experience and can lead to feelings of invalidation. Regulatory requirements for DHPs mandate a thorough and unbiased assessment, considering all contributing factors to a patient's condition. The professional decision-making process for similar situation should involve a systematic evaluation. First, conducting a comprehensive history and physical examination, including a detailed pain assessment onset, duration, intensity, character, aggravating/alleviating factors, impact on function. Second, reviewing relevant investigations and diagnostic imaging. Third, considering the patient's psychosocial factors and functional limitations. Fourth, developing a collaborative treatment plan that incorporates evidence-based pharmacological, non-pharmacological, and rehabilitative modalities, with clear goals and regular review. Finally, ensuring ongoing communication with the patient and other healthcare professionals involved in their care. Question 5. The assessment process reveals a patient with a mobility impairment who requires assistance to access examination rooms and use specific medical equipment. The patient expresses concern that the current facility layout and equipment present significant barriers to receiving consistent and effective care. The DHP is tasked with evaluating the situation and recommending the best course of action to ensure the patient's rights and access to healthcare are fully protected under federal law. Which of the following approaches best represents a professional and legally compliant response? Option A. The DHP should immediately initiate a review of the facility's physical accessibility and the availability of adaptive medical equipment, consulting with facility management to implement necessary modifications and acquire appropriate assistive devices to ensure equitable access for the patient. Option B. The DHP should focus solely on providing manual assistance to the patient for each appointment, without investigating broader systemic accessibility issues or potential equipment upgrades. Option C. The DHP should document the patient's complaint but take no immediate action, suggesting the patient submit a formal grievance through the hospital's administrative channels. Option D. The DHP should inform the patient that, while their concerns are noted, the facility's current infrastructure is standard, and that the patient may need to seek services at a facility better equipped to handle their specific needs. Correct answer is A. The DHP should immediately initiate a review of the facility's physical accessibility and the availability of adaptive medical equipment, consulting with facility management to implement necessary modifications and acquire appropriate assistive devices to ensure equitable access for the patient. Explanation: this scenario is professionally challenging because it requires a disability healthcare professional, DHP, to navigate the complex interplay of federal law, specifically the Americans with Disabilities Act, ADA, with the practicalities of providing healthcare services. The DHP must balance the legal obligations to ensure equal access and non-discrimination with the ethical duty to provide appropriate and effective care, all while respecting patient privacy and autonomy. The core challenge lies in identifying and implementing reasonable accommodations and modifications without compromising the quality or safety of care, and without overstepping legal boundaries. The correct approach involves a thorough understanding and application of Title II of the ADA, which prohibits discrimination on the basis of disability by state and local government entities, including public healthcare facilities. This approach prioritizes identifying specific barriers to access and developing tailored, reasonable modifications to overcome them. It requires proactive engagement with the patient to understand their needs and preferences, and a commitment to implementing solutions that are effective and compliant with ADA guidelines. This aligns with the DHP's professional responsibility to advocate for patients and ensure equitable access to healthcare services, as mandated by the ADA principles of non-discrimination and reasonable accommodation. An incorrect approach that focuses solely on the patient's stated preference, without considering the broader legal framework of Title II, would be professionally unacceptable. This fails to acknowledge the DHP's obligation to ensure the facility itself is accessible, and that services are provided in a non-discriminatory manner, which may involve more than just accommodating a single request. Another incorrect approach that dismisses the patient's request due to perceived inconvenience or a misunderstanding of ADA requirements represents a direct violation of the law and ethical standards. This demonstrates a failure to understand the DHP's role in facilitating access and upholding patient rights. Finally, an approach that attempts to circumvent ADA requirements by suggesting the patient seek services elsewhere without a valid, legally defensible reason, e. G. Lack of specialized equipment that cannot be reasonably acquired is discriminatory and unethical. Professionals should approach such situations by first identifying the relevant legal framework. In this case, Title Roman II of the ADA. They should then engage in a collaborative process with the patient to understand their specific needs and the barriers they are encountering. This should be followed by an assessment of potential reasonable modifications or accommodations that can be implemented within the facility or service delivery. Documentation of the process, the identified barriers, and the implemented solutions is crucial for accountability and future reference. If a requested accommodation cannot be provided, the DHP must be able to articulate a legally sound and ethically justifiable reason and explore alternative solutions. Question 6. The monitoring system demonstrates a consistent pattern of patients with hearing impairments experiencing delays in receiving necessary medical information due to communication barriers. In a specific instance, a deaf patient arrives for a scheduled appointment, and the assigned DHP notes that no sign language interpreter has been booked, and the patient communicates primarily through British Sign Language, BSL. What is the most appropriate immediate action for the DHP to take to ensure effective and compliant patient care? Option A. Proceed with the appointment, attempting to communicate through written notes and gestures, and inform the patient that an interpreter will be scheduled for future appointments. Option B. Ask a family member accompanying the patient to interpret, explaining that this is a temporary measure due to the lack of a booked interpreter. Option C. Ask a junior administrative staff member who has some basic knowledge of BSL to facilitate communication for this appointment. Option D. Immediately reschedule the appointment for a time when a qualified, independent BSL interpreter can be present, ensuring the patient understands the reason for the reschedule and the plan for future interpretation. The correct answer is A. Proceed with the appointment, attempting to communicate through written notes and gestures, and inform the patient that an interpreter will be scheduled for future appointments. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for effective communication with the patient's right to privacy and dignity, while adhering to specific regulatory requirements for interpreting services. The disability healthcare professional, DHP, must ensure that the patient fully understands their medical condition, treatment options, and can provide informed consent, which is fundamentally compromised without appropriate language access. The DHP must also ensure that the chosen interpreter meets professional standards and is not a barrier to care. The correct approach involves proactively identifying the patient's communication needs and engaging a qualified, independent sign language interpreter. This ensures that the patient receives accurate and confidential communication, respecting their autonomy and right to receive healthcare services in a language they understand. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as regulatory frameworks that mandate accessible healthcare for individuals with disabilities, including those who use sign language. The use of a qualified interpreter minimizes the risk of miscommunication, which could lead to incorrect diagnoses, inappropriate treatments, or breaches of patient confidentiality. An incorrect approach would be to proceed with the appointment without a qualified interpreter, assuming the patient can understand or will ask for clarification. This fails to meet the DHP's professional obligation to ensure effective communication and informed consent, potentially leading to patient harm and violating regulations that mandate reasonable accommodations for communication disabilities. Another incorrect approach would be to use a family member or untrained staff member as an interpreter. While seemingly convenient, this poses significant risks. Family members may not possess the necessary vocabulary or understanding of medical terminology, may inadvertently filter or omit information due to personal relationships or emotional involvement, and can compromise patient confidentiality. Untrained staff may lack the specific skills and ethical training required of professional interpreters, leading to inaccuracies and potential breaches of privacy. Both scenarios undermine the patient's right to independent and confidential communication, and may contravene professional standards and legal requirements for qualified interpreting services. The professional decision-making process for similar situations should involve a systematic assessment of the patient's communication needs at the outset of care. This includes asking direct questions about preferred communication methods and language. If a need for an interpreter is identified, the DHP should consult established protocols for engaging qualified and certified interpreters, prioritizing those who are independent of the patient's personal network to ensure impartiality and confidentiality. Documentation of the patient's communication needs and the steps taken to address them is also crucial. Question 7. Market research demonstrates that effective collaboration between healthcare professionals and educational institutions is vital for supporting students with disabilities. A disability healthcare professional, DHP, has been asked to provide input for an individualized education program (EAP) for a student with a chronic health condition. The student's condition has recently stabilized, but the DHP is aware that the student may still experience fatigue and require specific environmental considerations during school hours. What is the most appropriate approach for the DHP to take in providing their input to the IEP team? Option A. Submit a report stating that the student's condition is stable and therefore no specific educational accommodations are currently necessary, deferring all decisions to the student's parents. Option B. Conduct a comprehensive, individualized assessment of the student's current health status and its specific impact on their ability to participate in the educational program, providing detailed recommendations for accommodations and services to the IEP team. Option C. Provide general recommendations based on the student's diagnosed chronic health condition, assuming that standard accommodations for such conditions will be sufficient. Option D. Advise the school to implement a blanket policy for all students with chronic health conditions, focusing on minimizing potential disruptions to the school's operations. The correct answer is B. Conduct a comprehensive, individualized assessment of the student's current health status and its specific impact on their ability to participate in the educational program, providing detailed recommendations for accommodations and services to the IEP team. Explanation: this scenario is professionally challenging because it requires a disability healthcare professional, DHP, to navigate the complex legal and ethical landscape of the Individuals with Disabilities Education Act (IDEA), while balancing the needs of a student with a disability and the requirements of the educational institution. The DHP must ensure that the student receives a free appropriate public education, FAPE, as mandated by IDEA, which involves understanding and implementing the student's individualized education program, EAP. The core challenge lies in interpreting the student's current health status and its direct impact on their ability to access the educational curriculum and participate in school activities, and then translating this into actionable recommendations within the IEP framework. The correct approach involves a thorough, individualized assessment of the student's current health status and its specific impact on their educational needs. This assessment must directly inform recommendations for accommodations and services within the IEP, ensuring that the student can access the general education curriculum to the maximum extent possible, as required by IDEA. The DHP's role is to provide expert medical and health-related input to the IEP team, ensuring that the student's educational program is tailored to their unique needs and that they are making meaningful educational progress. This aligns with the IDEA mandate to provide FAPE and to ensure that students with disabilities are educated with non-disabled peers to the greatest extent appropriate. An incorrect approach would be to make generalized recommendations based on the student's disability category without a specific, current assessment of their individual health status and its impact on their educational participation. This fails to meet the individualized nature of IDEA and the IEP process. Another incorrect approach would be to prioritize the convenience or resources of the school over the documented health needs of the student, potentially leading to a denial of FAPE. Furthermore, failing to document the assessment and recommendations clearly or not communicating effectively with the IEP team would also be a significant professional and regulatory failure, hindering the team's ability to develop an appropriate IEP. Professionals should approach such situations by first understanding the specific legal mandates of IDEA, particularly the requirements for FAPE and the IEP process. They must then conduct a comprehensive, individualized assessment that directly links the student's health status to their educational performance and participation. This assessment should be clearly documented and communicated to the IEP team. The decision-making process should prioritize the student's best interests and their right to an appropriate education, guided by evidence-based practice and regulatory compliance. Collaboration with parents, educators, and other relevant professionals is crucial to ensure a holistic and effective educational plan. Question 8. Compliance review shows a patient diagnosed with a severe depressive episode is refusing a prescribed course of electroconvulsive therapy (ECT), stating they do not want to undergo the procedure. The patient appears distressed and agitated, but is able to articulate their reasons for refusal, citing fear of memory loss. The DHP is considering how to proceed. Which of the following represents the most appropriate course of action in accordance with mental health legislation and ethical guidelines for healthcare professionals? Option A. Agree to the patient's refusal and explore alternative, less effective treatments without further assessment of their capacity to avoid conflict and distress. Option B. Proceed with obtaining consent for ECT from a nominated next of kin, as the patient's distress indicates a lack of capacity to make this decision. Option C. Immediately initiate involuntary treatment procedures for ECT, as the patient's refusal in the context of severe depression is likely a manifestation of their illness and poses a risk to their well-being. Option D. Conduct a formal documented assessment of the patient's capacity to consent to or refuse ECT, considering their understanding of the treatment, its benefits, risks, and alternatives, and their ability to retain and use this information to make a decision. The correct answer is B. Proceed with obtaining consent for ECT from a nominated next of kin, as the patient's distress indicates a lack of capacity to make this decision. Explanation. This scenario is professionally challenging because it requires balancing a patient's expressed wishes with the clinician's professional judgment regarding their mental state and capacity to make informed decisions about their care, particularly when those decisions might pose a risk to their well-being. The core tension lies in respecting patient autonomy versus fulfilling the duty of care, all within the strictures of mental health legislation. The correct approach involves a thorough, documented assessment of the patient's capacity to consent to or refuse treatment, considering their current mental state and understanding of the implications of their decision. This aligns with the principles of informed consent and the legal frameworks governing mental health treatment, which mandate that decisions are made by individuals who have the capacity to understand the information provided and appreciate the consequences of their choices. If capacity is found to be lacking, the subsequent steps must follow the legally defined pathways for treatment without consent, ensuring that the patient's best interests are paramount and that all actions are proportionate and least restrictive. An incorrect approach that proceeds with treatment without a formal capacity assessment, assuming the patient's refusal is solely due to their current mental health condition, fails to uphold the fundamental right to autonomy and informed consent. This bypasses crucial legal safeguards designed to protect individuals who may be experiencing a mental health crisis, but still retain the capacity to make decisions. Another incorrect approach that immediately seeks to override the patient's wishes through involuntary treatment, without first exhausting all avenues of communication, de-escalation, and a formal capacity assessment, is also a significant regulatory and ethical failure. It demonstrates a lack of respect for the patient's dignity and can erode trust, potentially exacerbating their distress. The legal framework typically requires a clear demonstration of risk and a lack of capacity before resorting to involuntary measures. Professionals should employ a decision-making framework that prioritizes a comprehensive, person-centered assessment of capacity. This involves clear communication, providing information in an accessible format, and actively exploring the patient's reasoning. If capacity is in doubt, a structured assessment process involving relevant professionals and adhering to legal protocols is essential. The principle of least restrictive intervention should guide all subsequent actions, ensuring that any decision made in the absence of capacity is the one that best serves the patient's welfare while respecting their rights as much as possible. Question 9. The evaluation methodology shows that a patient with a chronic disability has been recommended a specialized treatment plan, but they express significant concerns about their ability to attend the required regular appointments due to transportation challenges and the need for personal assistance. The DHP has identified that local public transport is not fully accessible for the patient's mobility needs, and their usual support person is unavailable for the duration of the treatment. What is the most appropriate course of action for the disability healthcare professional? Option A. Collaborate with the patient to explore alternative transportation options, investigate community-based support services for personal assistance during appointments, and advocate with the healthcare provider for flexible scheduling or telehealth options if feasible. Option B. Refer the patient to a general social services department, without further specific follow-up on their healthcare access needs. Option C. Inform the patient that due to these logistical challenges, the specialized treatment may not be suitable for them at this time, and suggest they seek a less demanding alternative. Option D. Document the patient's stated inability to attend appointments and advise them to reschedule when their circumstances improve. The correct answer is A. Collaborate with the patient to explore alternative transportation options. Investigate community-based support services for personal assistance during appointments, and advocate with the healthcare provider for flexible scheduling or telehealth options if feasible. Explanation: this scenario presents a professional challenge because it requires balancing the immediate needs of a patient with limited resources against the ethical obligation to provide equitable access to care. The disability healthcare professional, DHP, must navigate potential systemic barriers that disproportionately affect individuals with disabilities, ensuring that their care is not compromised by factors outside of their control. Careful judgment is required to identify and address these barriers without overstepping professional boundaries or making assumptions about the patient's capabilities or desires. The correct approach involves actively advocating for the patient by exploring all available avenues for support and accommodation. This includes collaborating with the patient to understand their specific needs and preferences, identifying potential barriers to accessing the recommended treatment, such as transportation, communication, or financial concerns, and then working with the patient and relevant services to mitigate these barriers. This approach aligns with the DHP's ethical duty to promote patient well-being and uphold principles of justice and fairness in healthcare. It also reflects a commitment to person-centered care, where the individual's autonomy and lived experience are central to the care plan. Regulatory frameworks for DHPs emphasize the importance of removing barriers to care and ensuring that individuals with disabilities receive appropriate and timely services. An incorrect approach would be to simply document the patient's inability to access care without further action. This fails to address the underlying systemic issues and effectively abandons the patient to their barriers, which is a dereliction of the DHP's duty to advocate. It also risks perpetuating disparities in healthcare access. Another incorrect approach would be to unilaterally decide that the patient is not a suitable candidate for the treatment due to anticipated access issues, without consulting the patient or exploring solutions. This is paternalistic and undermines patient autonomy. It also assumes that barriers are insurmountable, which may not be the case with appropriate support. A third incorrect approach would be to refer the patient to a general social worker without specific consideration for the patient's disability-related needs or the unique challenges they face in accessing healthcare. While social work support is valuable, a targeted approach that acknowledges and addresses disability-specific barriers is essential for effective advocacy and ensuring equitable access. The professional decision-making process for similar situations should involve a systematic assessment of barriers, collaborative problem-solving with the patient, and proactive engagement with available resources and support systems. DHPs should be trained to identify common barriers faced by individuals with disabilities and to develop strategies for overcoming them, always prioritizing the patient's well-being and autonomy. Question 10. Cost-benefit analysis shows that a particular advanced communication device offers significant potential for improving an individual's social interaction and independence. However, the device requires extensive, specialized training for both the user and their primary caregiver to be utilized effectively. The DHP is presented with two training options. Option 1 involves a brief, standardized group training session at community center, which is the most cost-effective. Option 2 involves personalized, in-home training sessions tailored to the individual's specific needs and learning pace, which is significantly more expensive. Considering the long-term efficacy and user outcomes, which training approach is most aligned with professional best practices for assistive technology implementation? Option A. Recommend a hybrid approach where the individual attends the group session and the caregiver receives a brief online tutorial, as this balances cost with some level of tailored information. Option B. Advise against the advanced communication device altogether, suggesting a simpler, less expensive alternative that requires minimal training to avoid the higher training costs. Option C. Opt for the standardized group training session due to its lower cost, assuming that the individual and caregiver can adapt and learn the device's functionalities independently after the initial introduction. Option D. Prioritize the personalized, in-home training sessions, as this approach is more likely to ensure the individual and caregiver acquire the necessary skills for effective and sustained use of the assistive device, maximizing its benefits and promoting independence. The correct answer is D. Prioritize the personalized, in-home training sessions, as this approach is more likely to ensure the individual and caregiver acquire the necessary skills for effective and sustained use of the assistive device, maximizing its benefits and promoting independence. Explanation: this scenario is professionally challenging because it requires a disability healthcare professional, DHP, to balance the immediate need for functional improvement with the long-term sustainability and efficacy of assistive technology. At training, the DHP must consider not only the initial cost of the AT, but also the ongoing investment in training, potential for user adoption, and the impact on the individual's overall quality of life and independence. Careful judgment is required to ensure that the chosen AT and training approach are appropriate, evidence-based, and aligned with the individual's goals and capabilities, adhering to professional standards and ethical obligations. The correct approach involves a comprehensive assessment of the individual's needs, environment, and goals, followed by the selection of appropriate AT and a tailored, multimodal training program. This approach prioritizes user-centered care, ensuring that the AT is not just a device, but a tool that genuinely enhances the individual's functioning and participation. Regulatory frameworks and ethical guidelines for DHPs emphasize the importance of individualized care, evidence-based practice, and promoting autonomy. This includes ensuring that training is delivered in a manner that is accessible, understandable, and empowers the individual to use the AT effectively and safely. The focus is on achieving meaningful outcomes and maximizing the benefits of the AT investment. An incorrect approach that focuses solely on the initial cost of the AT without adequate consideration for training and long-term support fails to meet the ethical obligation to provide effective and sustainable solutions. This can lead to underutilization or abandonment of the AT, resulting in wasted resources and unmet needs. Another incorrect approach that prioritizes a one-size-fits-all training model overlooks the unique learning styles, cognitive abilities, and environmental factors of individuals with disabilities. This can result in ineffective training, frustration, and a failure to achieve the intended benefits of the AT. Furthermore, an approach that neglects to involve the individual and their support network in the AT selection and training process undermines the principle of shared decision-making and can lead to poor adherence and satisfaction. Professionals should employ a decision-making framework that begins with a thorough needs assessment, considering the individual's functional limitations, environmental context, personal preferences, and desired outcomes. This should be followed by an evidence-based selection of AT, considering its suitability, cost-effectiveness, including training and maintenance, and potential for integration into the individual's life. The training plan should be individualized, delivered by competent professionals, and incorporate ongoing evaluation and adjustment to ensure effectiveness and user empowerment. Collaboration with the individual, their family, and other relevant professionals is crucial throughout this process. Question 11. The risk matrix shows a moderate risk of falls for an elderly client with mobility impairments in their bathroom. The client expresses a strong preference for a specific, aesthetically pleasing, but potentially less functional grab bar style they saw online, and suggests a DIY installation to save costs. As a disability healthcare professional, DHP, what is the most appropriate approach to recommending home modifications for this bathroom? Option A. Advise the client that grab bars are generally not effective and suggest alternative strategies like increased supervision, as the client's preference for a specific style indicates they are not serious about safety modifications. Option B. Recommend a comprehensive assessment of the bathroom's layout and the client's specific functional needs to determine the most appropriate and safely installed grab bars and other accessibility features, prioritizing safety and compliance with accessibility standards over the client's initial aesthetic preference and DIY suggestion. Option C. Proceed with recommending the client's chosen grab bar style and DIY installation, but include a disclaimer that the DHP is not responsible for any adverse outcomes, as this shifts the liability away from the professional. Option D. Immediately approve the client's preferred grab bar style and endorse the DIY installation, as the client's wishes and cost savings are paramount in client-centered care. The correct answer is B. Recommend a comprehensive assessment of the bathroom's layout and the client's specific functional needs to determine the most appropriate and safely installed grab bars and other accessibility features, prioritizing safety and compliance with accessibility standards over the client's initial aesthetic preference and DIY suggestion. Explanation: this scenario is professionally challenging because it requires balancing the client's immediate perceived needs and preferences with the DHP's professional responsibility to ensure safety, functionality, and compliance with relevant accessibility standards. The DHP must act as an advocate while also upholding professional ethics and legal obligations. Careful judgment is required to avoid over-reliance on the client's subjective experience, which may not fully account for long-term usability or potential hazards. The correct approach involves a comprehensive assessment of the client's current and anticipated functional needs, a thorough evaluation of the existing home environment, and the application of established accessibility guidelines and best practices for home modifications. This approach prioritizes evidence-based recommendations that promote independence, safety, and dignity for the client. Aligning with the DHP's duty of care and professional standards, it ensures that modifications are not only aesthetically pleasing or convenient, but also structurally sound, appropriately located, and meet the specific requirements for accessibility, such as those outlined in relevant building codes or disability access standards. An incorrect approach that focuses solely on the client's stated preference for a specific type of grab bar without assessing its suitability for the bathroom layout, the client's grip strength, or the wall structure would be professionally unacceptable. It fails to consider the critical safety and functional aspects, potentially leading to an ineffective or even dangerous installation. Another incorrect approach that prioritizes the cheapest available materials over durability and safety standards would also be a failure. This neglects the long-term well-being of the client and the ethical obligation to recommend solutions that are fit for purpose and provide lasting benefit. Furthermore, an approach that disregards the need for professional installation of structural elements like ramps, assuming a DIY solution is adequate, would be a significant ethical and safety lapse, potentially leading to structural failure and injury. Professionals should employ a decision-making framework that begins with a thorough client assessment, including their functional abilities, limitations, goals, and preferences. This should be followed by a detailed environmental assessment of the home. Recommendations should then be developed based on a synthesis of this information, informed by relevant accessibility standards, best practices, and the DHP's professional expertise. The process should involve collaborative discussion with the client, explaining the rationale behind recommendations and exploring alternatives, ensuring informed consent and shared decision-making. Question 12. Stakeholder feedback indicates that some disability healthcare professionals, DHP, are struggling to balance client-driven goals with evidence-based rehabilitation and habilitation strategies. Considering the regulatory framework for DHPs, which of the following approaches best reflects the professional standard for developing and implementing rehabilitation and habilitation plans? Option A. Focusing exclusively on interventions that the client expresses a strong interest in, regardless of their proven efficacy or alignment with broader rehabilitation objectives. Option B. Conducting a comprehensive assessment of the client's strengths, needs, and functional capacity, then collaboratively developing a plan with the client that incorporates evidence-based interventions and realistic, achievable goals. Option C. Implementing a standardized rehabilitation protocol that has shown general success in similar cases, with minimal deviation to accommodate individual client preferences. Option D. Prioritizing client-stated goals, even if they appear ambitious or not fully aligned with current functional capacity, and developing a plan that directly addresses these goals with the most readily available interventions. The correct answer is D. Prioritizing client-stated goals, even if they appear ambitious or not fully aligned with current functional capacity, and developing a plan that directly addresses these goals with the most readily available interventions. Explanation: this scenario is professionally challenging because it requires balancing the immediate needs and preferences of a client with the long-term, evidence-based best practices for rehabilitation and habilitation, all while adhering to the specific regulatory framework governing disability healthcare professionals, DHP. The DHP must navigate potential conflicts between client autonomy and professional expertise, ensuring that the chosen approach is both person-centered and clinically sound, and compliant with DHP standards. The correct approach involves a collaborative process where the DHP actively engages the client in setting realistic, achievable goals that are aligned with their individual strengths, needs, and aspirations, while also incorporating evidence-based interventions. This approach is justified by the DHP's ethical obligation to promote client well-being and independence, as mandated by the DHP regulatory framework, which emphasizes person-centered care and the use of validated therapeutic techniques. Furthermore, regulatory guidelines for DHPs stress the importance of shared decision-making and tailoring interventions to the unique circumstances of each individual. An incorrect approach that prioritizes solely the client's immediate, potentially unrealistic desires without a thorough assessment of their capacity or the feasibility of achieving those desires fails to uphold the DHP's duty of care. This neglects the professional responsibility to guide clients towards sustainable progress and can lead to frustration and a lack of meaningful improvement, potentially violating ethical principles of beneficence and non-maleficence. Another incorrect approach that imposes a rigid, predetermined rehabilitation plan without sufficient client input or consideration of their lived experience disregards the principle of client autonomy and dignity. This can lead to disengagement and a failure to achieve optimal outcomes, contravening regulatory expectations for individualized care plans that respect the client's values and preferences. A third incorrect approach that relies on anecdotal evidence or unvalidated techniques, even if suggested by the client, is professionally unacceptable. DHPs are bound by regulations to utilize evidence-based practices, ensuring that interventions are effective and safe. Deviating from this standard risks harm to the client and breaches professional accountability. The professional decision-making process for similar situations should involve a systematic assessment of the client's needs, goals, and preferences, followed by an exploration of evidence-based rehabilitation and habilitation strategies. This should be conducted in a collaborative manner, fostering open communication and shared decision-making. The DHP must then critically evaluate the feasibility and potential effectiveness of proposed interventions, ensuring alignment with regulatory requirements and ethical standards, before jointly developing and implementing a personalized care plan. Question 13. Risk assessment procedures indicate that a client with a progressive neurological condition requires modifications to their home to improve safety and independence. The client has expressed a strong preference for a specific type of smart home technology they saw advertised. What is the most appropriate initial step for the disability healthcare professional, DHP, to take? Option A. Prioritize the least expensive assistive technology and environmental modifications that appear to address the client's stated needs, regardless of the client's specific preferences or the home environment. Option B. Immediately recommend the specific smart home technology the client prefers, assuming it will meet their needs and can be integrated into their home. Option C. Proceed with implementing general environmental modifications such as grab bars and ramp installations, without discussing assistive technology options with the client. Option D. Conduct a comprehensive functional and environmental assessment of the client's home, considering their current and anticipated needs, and then discuss potential assistive technology and environmental modification options, including the client's preferred technology, in the context of the assessment findings. The correct answer is D. Conduct a comprehensive functional and environmental assessment of the client's home, considering their current and anticipated needs, and then discuss potential assistive technology and environmental modification options, including the client's preferred technology, in the context of the assessment findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the disability healthcare professional, DHP, to balance the client's expressed preferences for assistive technology with the DHP's professional judgment regarding the most effective and safe environmental modifications. The DHP must navigate potential conflicts between client autonomy and the professional's duty of care, ensuring that recommendations are evidence-based and aligned with regulatory standards for accessibility and safety. The challenge lies in translating a client's desire into a practical, compliant, and beneficial solution. Correct approach analysis. The correct approach involves a thorough assessment of the client's specific needs, functional limitations, and the existing home environment, followed by a collaborative discussion with the client about potential assistive technologies and environmental modifications. This approach is right because it prioritizes a person-centered plan, which is a cornerstone of disability healthcare practice. It ensures that recommendations are tailored to the individual, promoting independence and quality of life. Regulatory frameworks for disability services typically mandate that interventions are based on comprehensive assessments and involve the client in decision-making. This collaborative process also helps to manage expectations and ensure buy-in, leading to better adherence and outcomes. Ethical guidelines emphasize respecting client autonomy while ensuring their safety and well-being. Incorrect approaches analysis. Recommending a specific assistive technology solely based on the client's stated preference without a comprehensive environmental assessment fails to meet regulatory requirements for evidence-based practice and duty of care. This approach risks prescribing a solution that is incompatible with the home environment, potentially unsafe, or not the most effective for the client's specific needs. It overlooks the professional's responsibility to ensure that modifications are practical and beneficial. Implementing environmental modifications without consulting the client about their preferences for assistive technology disregards client autonomy and the principle of person-centered care. This can lead to a solution that the client finds intrusive, unhelpful, or aesthetically displeasing, undermining their engagement and satisfaction with the intervention. It also fails to leverage the potential of assistive technology to enhance independence, focusing solely on cost-effectiveness without considering the client's functional needs and environmental suitability is a regulatory and ethical failure. While cost is a factor, it cannot be the primary determinant when it compromises the effectiveness, safety, or appropriateness of assistive technology and environmental modifications for the client's disability. This approach prioritizes financial considerations over the client's well-being and right to appropriate support. Professional reasoning. Professionals should adopt a systematic approach that begins with a comprehensive needs assessment, encompassing functional abilities, environmental barriers, and client goals. This should be followed by exploring a range of evidence-based assistive technology and environmental modification options. Crucially, a collaborative discussion with the client is essential to understand their preferences, values, and priorities. The DHP must then integrate this information with their professional expertise to formulate recommendations that are safe, effective, compliant with relevant regulations, and aligned with the client's expressed wishes and overall well-being. This iterative process ensures that the final plan is both clinically sound and client-centered. Question 14. Risk assessment procedures indicate a family is experiencing significant distress due to a recent diagnosis of a complex disability in their child, and they are struggling to understand and access the necessary healthcare, educational, and social support services. They express feeling overwhelmed by the volume of information and the perceived bureaucracy involved. As a disability healthcare professional, DHP, what is the most appropriate initial approach to support this family? Option A. Provide the family with a comprehensive, uncurated list of all potential government agencies and support organizations related to the child's disability, without further discussion or assessment of their immediate needs. Option B. Advise the family that navigating these systems is their sole responsibility, and that the DHP's role is limited to providing the medical diagnosis, offering no further support or guidance. Option C. Empathetically listen to the family's concerns, validate their feelings of being overwhelmed, and then collaboratively identify the specific systems and resources they need assistance with, providing clear, actionable information and empowering them to navigate these systems. Option D. Immediately contact all relevant service providers on behalf of the family and attempt to expedite their applications, assuring the family that all their needs will be met promptly. The correct answer is C. Empathetically listen to the family's concerns, validate their feelings of being overwhelmed, and then collaboratively identify the specific systems and resources they need assistance with, providing clear, actionable information and empowering them to navigate these systems. Explanation. This scenario is professionally challenging because it requires the disability healthcare professional, DHP, to balance the immediate needs of a distressed family with the complex, often bureaucratic, systems they must navigate. The DHP must act as a bridge, translating information and advocating effectively without overstepping professional boundaries or making promises they cannot keep. Careful judgment is required to ensure the family feels heard and supported, while also providing accurate guidance within the established legal and ethical frameworks. The correct approach involves actively listening to the family's concerns, validating their feelings, and then systematically identifying the specific systems and resources relevant to their situation. This approach prioritizes clear communication, empathy, and practical, actionable steps. It aligns with the DHP's ethical duty to support individuals and their families in accessing appropriate care and services. Regulatory frameworks for DHPs often emphasize patient-centered care, which extends to supporting the family unit. This includes providing information about rights, entitlements, and available support services in an understandable manner, thereby empowering the family to advocate for themselves. An incorrect approach that focuses solely on providing a list of agencies, without understanding the family's specific needs, fails to acknowledge the emotional distress and confusion the family is experiencing. This approach neglects the empathetic component of care and can leave the family feeling overwhelmed and unsupported, potentially violating ethical guidelines that mandate compassionate and holistic care. Another incorrect approach that involves directly intervening and making demands on the systems on behalf of the family, without proper authorization or understanding of the system's processes, can lead to negative repercussions for the family and the DHP. This could involve misrepresentation, creating false expectations, or even legal complications, contravening professional conduct regulations that require honesty, integrity, and adherence to established procedures. A further incorrect approach that dismisses the family's concerns as being outside the DHP's scope of practice, without offering any alternative support or referral, demonstrates a lack of commitment to the family's well-being and can be seen as a failure to uphold the professional duty of care. This approach neglects the broader responsibility of a DHP to facilitate access to necessary support, even if direct intervention is not possible. The professional decision-making process for similar situations should involve a tiered approach. First, establish rapport and actively listen to understand the family's immediate concerns and emotional state. Second, assess the situation to identify the core issues and the relevant systems involved. Third, provide clear, concise, and accurate information about available resources and processes, explaining the family's rights and options. Fourth, collaboratively develop a plan of action with the family, outlining realistic steps and offering support in navigating the initial stages. Finally, ensure appropriate follow-up and referral to specialized services if necessary, always respecting the family's autonomy and capacity to make decisions. Question 15. The risk matrix shows a moderate likelihood of a client experiencing a decline in independence due to their progressive neurological condition. The client, Mr. Henderson, reports he can still manage most of his daily tasks, but his daughter expresses concern about his safety when he is alone, particularly with meal preparation and managing his medication schedule. As a DHP, what is the most appropriate next step in assessing Mr. Henderson's functional capacity? Option A. Primarily interview Mr. Henderson's daughter to gather information about his functional abilities, as her concerns about his safety are the most critical indicators of his declining independence. Option B. Administer a standardized ADL/IEDL questionnaire without any environmental observation or direct client interview, assuming the standardized scores will accurately reflect his functional status. Option C. Rely solely on Mr. Henderson's self-reported ability to perform ADLs and IEDL, as his autonomy is paramount and his perception of his capabilities should be the primary determinant. Option D. Conduct a comprehensive functional assessment in Mr. Henderson's home environment, observing his performance of ADLs and IEDL, and engaging in direct conversation with him about his perceived abilities and challenges, while also incorporating his daughter's observations. The correct answer is D. Conduct a comprehensive functional assessment in Mr. Henderson's home environment, observing his performance of ADLs and IEDL, and engaging in direct conversation with him about his perceived abilities and challenges, while also incorporating his daughter's observations. Explanation. This scenario presents a professional challenge because it requires the disability healthcare professional, DHP, to move beyond a simple checklist of ADLs and IEDL and to interpret the client's functional capacity within the context of their specific environment and personal goals. The DHP must balance objective assessment with subjective client reporting and consider the impact of the disability on the client's overall quality of life and independence. Careful judgment is required to ensure the assessment is comprehensive, accurate, and leads to appropriate support planning. The correct approach involves a holistic assessment that considers the client's ability to perform ADLs e.g., bathing, dressing, eating, and IADL e.g., managing finances, preparing meals, using transportation in their usual environment. This approach is right because it aligns with the DHP's ethical and professional duty to provide person-centered care. Regulatory frameworks for DHPs emphasize the importance of understanding the individual's functional limitations and their impact on daily life to facilitate appropriate interventions and support. This comprehensive view ensures that the assessment is not merely a list of tasks, but a nuanced understanding of the client's lived experience and their capacity for self-care and community participation. An incorrect approach that focuses solely on the client's self-reported ability to perform tasks without considering environmental factors or objective observation fails to meet the professional standard. This is ethically problematic, as it may lead to an underestimation or overestimation of the client's needs, potentially resulting in inadequate support or unnecessary interventions. It also neglects the DHP's responsibility to gather comprehensive data. Another incorrect approach that prioritizes a standardized, rigid assessment tool without adapting it to the client's specific disability and cultural context is also professionally unacceptable. This can lead to a biased or incomplete assessment, failing to capture the true extent of the client's functional challenges or strengths. Regulatory guidelines for DHPs stress the need for culturally sensitive and individualized assessments. A third incorrect approach that relies solely on the observations of family members or caregivers without direct engagement with the client overlooks the client's autonomy and right to self-determination. While caregiver input is valuable, the client's perspective and direct assessment of their capabilities are paramount in determining their needs and preferences. The professional decision-making process for similar situations should involve 1. Understanding the client's stated goals and priorities. 2. Conducting a thorough assessment of ADLs and IADL, considering both the client's self-report and objective observation within their natural environment. 3. Incorporating input from relevant support persons while prioritizing the client's voice. 4. Analyzing the interplay between the disability, the environment, and the client's functional capacity. 5. Documenting findings clearly and using them to inform a person-centered care plan. Question 16. The performance metrics show a significant improvement in the speed and accuracy of a client's participation in activities of daily living ADL and instrumental activities of daily living IADL related to meal preparation. However, the client consistently reports that these tasks still feel very difficult and exhausting. Considering the client's occupational therapy goals focused on enhancing fine motor skills and sensory integration for independent living, which of the following approaches best reflects a professional and ethical response to this discrepancy? Option A. Continue with the current intervention plan, as the objective performance metrics indicate success, and the client's subjective feelings are less critical than measurable outcomes. Option B. Immediately discontinue the current intervention plan and explore entirely new strategies, assuming the client's subjective report signifies a complete failure of the existing approach. Option C. Conduct a further assessment to explore the discrepancy between objective performance and subjective experience, considering factors such as fatigue, sensory processing challenges, or the client's perception of effort versus actual functional capacity, and collaboratively adjust the intervention plan based on these findings. Option D. Focus solely on the client's subjective report of difficulty and exhaustion, reducing the demands of ADLs and IADL to a level that the client feels is easy, even if it means not progressing towards the established performance goals. Correct answer is A. Continue with the current intervention plan, as the objective performance metrics indicate success, and the client's subjective feelings are less critical than measurable outcomes. Explanation. This scenario presents a professional challenge because it requires the disability healthcare professional, DHP, to interpret subjective client reports alongside objective performance metrics to determine the most effective intervention strategy. The DHP must balance the client's perceived progress with measurable outcomes, ensuring that interventions are evidence-based, client-centered, and aligned with professional standards for occupational therapy practice. The challenge lies in discerning whether the client's self-assessment accurately reflects their functional capacity, or if it's influenced by factors like motivation, fatigue, or a misunderstanding of the goals. The correct approach involves a comprehensive evaluation that integrates the client's subjective feedback with objective data from performance metrics. This approach is best professional practice because it adheres to the principles of client-centered care, which mandate that the client's perspective and experience are integral to the therapeutic process. Furthermore, it aligns with the DHP's ethical obligation to provide evidence-based interventions, requiring the use of objective data to inform clinical decisions. By comparing the client's self-reported ease of task completion with the observed performance metrics e.g., time taken, accuracy, use of compensatory strategies, the DHP can identify discrepancies and tailor interventions to address specific deficits or to reinforce strengths. This holistic assessment ensures that the DHP is not solely relying on one data source, leading to more accurate goal setting and effective treatment planning for ADLs and IEDL, and addressing underlying fine motor skills and sensory integration challenges. An incorrect approach would be to solely rely on the client's subjective report of ease, disregarding the performance metrics. This fails to acknowledge the objective evidence of functional limitations and could lead to premature discharge or a lack of necessary support, potentially violating the DHP's duty of care. Another incorrect approach would be to exclusively focus on the performance metrics without considering the client's subjective experience. This could lead to interventions that are not perceived as beneficial or relevant by the client, potentially impacting engagement and adherence to the treatment plan, and overlooking the client's lived experience of their disability. A third incorrect approach would be to assume that improved performance metrics automatically equate to successful mastery of ADLs and IEDL, without considering the client's ability to generalize these skills to their natural environment or their satisfaction with their functional independence. This overlooks the broader goals of occupational therapy, which include promoting meaningful participation and quality of life. The professional decision-making process for similar situations should involve a systematic review of all available data, including client self-reports, caregiver input, objective assessments, and performance metrics. The DHP should then synthesize this information to identify areas of strength and areas requiring further intervention. This synthesis should be followed by a collaborative discussion with the client to establish shared understanding and to jointly set realistic and achievable goals. The DHP must then select and implement interventions that are evidence-based and tailored to the individual's needs, continuously monitoring progress through both subjective and objective measures, and adjusting the plan as necessary. Question 17. What factors determine the most appropriate and effective home modifications for a client with a progressive neurological condition, considering their current functional level, the specific challenges posed by their living environment, and their stated desire for increased independence in daily activities? Option A. The availability of the least expensive modification options that address the most obvious physical obstacles in the home. Option B. Comprehensive assessment of the client's current functional abilities, a detailed analysis of environmental barriers within the home, and the application of evidence-based accessibility guidelines tailored to the client's specific needs and progressive condition. Option C. The client's initial expressed wishes for specific modifications, regardless of their current functional capacity or the objective assessment of environmental challenges. Option D. A standardized checklist of common home modifications for individuals with mobility impairments, applied uniformly without considering the client's specific diagnosis or the unique characteristics of their home. The correct answer is B. A comprehensive assessment of the client's current functional abilities, a detailed analysis of environmental barriers within the home, and the application of evidence-based accessibility guidelines tailored to the client's specific needs and progressive condition. Explanation. This scenario presents a professional challenge because the disability healthcare professional, DHP, must balance the client's expressed preferences with objective safety and functional needs, all within the constraints of available resources and regulatory guidelines for home modifications. The DHP's role is to advocate for the client while ensuring modifications are effective, safe, and compliant. Careful judgment is required to avoid over-modification that is unnecessary or under-modification that fails to meet essential needs. The correct approach involves a comprehensive, client-centered assessment that prioritizes safety and functional independence, informed by evidence-based practices and relevant accessibility standards. This approach is right because it directly addresses the core mandate of a DHP to facilitate optimal health and well-being for individuals with disabilities. Regulatory frameworks for DHPs typically emphasize a holistic assessment that considers the individual's specific condition, functional limitations, environmental barriers, and personal goals. Ethical guidelines underscore the importance of respecting client autonomy while ensuring their safety and promoting their quality of life. Therefore, a thorough evaluation of the home environment, in collaboration with the client and potentially their caregivers, to identify specific barriers and recommend appropriate, evidence-based modifications is paramount. This includes considering factors like the severity of the disability, the specific tasks the client needs to perform, and the physical layout of the home. An incorrect approach would be to solely rely on the client's initial, potentially limited, requests without further investigation. This fails to meet the professional obligation to conduct a thorough assessment and identify all potential barriers, which could lead to inadequate modifications that do not fully address the client's needs or even create new safety hazards. It also overlooks the DHP's responsibility to educate the client on best practices and available solutions. Another incorrect approach would be to recommend modifications based on generic, one-size-fits-all solutions, without tailoring them to the individual's specific circumstances and the unique characteristics of their home. This disregards the principle of individualized care and can result in costly, ineffective, or inappropriate modifications. It also fails to consider the practicalities of the existing home structure and the client's ability to adapt to new features. A third incorrect approach would be to prioritize cost-effectiveness above all else, leading to the selection of the cheapest options regardless of their long-term efficacy or safety. While resource limitations are a reality, the primary ethical and regulatory imperative is to ensure the client's safety and functional improvement. Compromising on essential safety features or functional benefits for the sake of minimal cost would be a significant professional failure. The professional decision-making process for similar situations should involve a systematic approach. 1. Establish rapport and actively listen to the client's stated needs and preferences. 2. Conduct a comprehensive functional assessment to understand the client's abilities and limitations in performing daily activities. 3. Perform a detailed environmental assessment of the home, identifying specific physical barriers and safety hazards. 4. Research and apply relevant accessibility standards and best practices for home modifications. 5. Collaborate with the client and relevant stakeholders to develop a prioritized list of recommended modifications, explaining the rationale and potential benefits of each. 6. Consider the client's financial resources and explore available funding options, while always prioritizing safety and functionality. 7. Document the assessment findings, recommendations, and the decision-making process thoroughly. Question 18. Examination of the data shows a client with a chronic neurological condition who expresses a strong desire to continue working in their previous profession, despite significant reported fatigue and mobility challenges. The client's family is concerned about their ability to manage the demands of the job and suggests a significant reduction in work hours or complete career change. The DHP is tasked with developing a support plan. Which of the following approaches best reflects a comprehensive understanding of disability and its context for this client? Option A. Conduct a detailed functional capacity evaluation to objectively measure the client's physical and cognitive abilities in relation to their job demands, and then propose accommodations based on these findings, prioritizing the client's stated goal of continued employment. Option B. Focus on the medical diagnosis and its known progression, recommending a phased retirement plan that aligns with typical trajectories for this condition, and advising the client and family on the inevitability of reduced work capacity. Option C. Implement a plan that minimizes the DHP's administrative burden by suggesting readily available, generic support services that require minimal individual customization, assuming these will address the client's needs. Option D. Prioritize the family's concerns by recommending a significant reduction in work hours or a complete career change, as their input is often indicative of the client's long-term well-being and safety. The correct answer is A. Conduct a detailed functional capacity evaluation to objectively measure the client's physical and cognitive abilities in relation to their job demands, and then propose accommodations based on these findings, prioritizing the client's stated goal of continued employment. Explanation. This scenario is professionally challenging because it requires the disability healthcare professional, DHP, to navigate the complex interplay between an individual's stated preferences, their functional limitations, and the broader societal and environmental factors that constitute disability. The DHP must move beyond a purely medical model to embrace a biopsychosocial understanding, recognizing that disability is not solely an individual impairment, but a result of the interaction between that impairment and environmental barriers. Careful judgment is required to ensure that interventions are person-centered, promote autonomy, and are aligned with the DHP's professional responsibilities under relevant disability legislation and ethical codes. The correct approach involves a comprehensive impact assessment that considers the individual's lived experience, their functional capabilities and limitations, and the environmental and societal factors that may create barriers or facilitators to their participation and well-being. This approach aligns with the principles of person-centered care, which is a cornerstone of modern disability support frameworks. It emphasizes understanding the individual holistically, respecting their autonomy and self-determination, and working collaboratively to identify solutions that enhance their quality of life. Regulatory frameworks often mandate a focus on the individual's needs and goals, promoting inclusion and equal opportunities, which this approach directly addresses. Ethical codes for healthcare professionals also stress the importance of respecting patient dignity and promoting their independence. An approach that focuses solely on the medical diagnosis and its associated physical limitations is incorrect because it adopts a narrow, impairment-focused view of disability. This fails to acknowledge the social model of disability, which posits that societal barriers are the primary cause of disability. Such an approach risks overlooking crucial environmental or attitudinal barriers that could be addressed to improve the individual's functioning and participation. It may also lead to interventions that are not aligned with the individual's actual needs or preferences, potentially undermining their autonomy and self-advocacy. An approach that prioritizes the perceived ease of implementation for the healthcare provider, without adequately considering the individual's preferences or the potential impact on their quality of life, is also incorrect. This approach risks being paternalistic and may not lead to sustainable or meaningful outcomes for the individual. It fails to uphold the ethical principle of beneficence, acting in the patient's best interest, if the chosen intervention, while easy for the provider, does not genuinely benefit the individual or address their core needs and aspirations. An approach that relies solely on the recommendations of family members or caregivers, without direct engagement with the individual with the disability, is ethically problematic. While family and caregivers are valuable sources of information, the individual with the disability is the primary stakeholder. Their voice, preferences, and consent are paramount. Failing to engage directly with the individual risks violating their right to self-determination and may result in support plans that do not reflect their wishes or best interests. A professional decision-making process for similar situations should involve a structured, multifaceted assessment. This begins with active listening and empathetic engagement with the individual to understand their perspective, goals, and challenges. It then involves a thorough assessment of their functional abilities and limitations, considering both physical and cognitive aspects. Crucially, this must be coupled with an analysis of the environmental and societal context, identifying barriers and facilitators. Collaboration with the individual, their family, with consent, and other relevant professionals is essential. Interventions should be co-designed, person-centered, and regularly reviewed to ensure they remain effective and aligned with the individual's evolving needs and aspirations, always adhering to relevant legal and ethical guidelines. Question 19. When evaluating the implementation of workplace accommodations for a disability healthcare professional experiencing challenges with prolonged standing and repetitive manual tasks, which of the following strategies best reflects a proactive and compliant approach to addressing ergonomic needs, modified equipment, and flexible scheduling? Option A. Providing a generic ergonomic assessment checklist for the professional to complete independently and advising them to seek external resources for equipment. Option B. Conducting a detailed functional needs assessment with the professional, researching specialized ergonomic seating and tools, and exploring the feasibility of adjusted shift patterns or task rotation. Option C. Implementing a blanket policy of mandatory task rotation for all staff in similar roles, regardless of individual needs or specific functional limitations. Option D, recommending a standard anti-fatigue mat and suggesting the professional take more frequent short breaks without altering their shift schedule. The correct answer is D, recommending a standard anti-fatigue mat and suggesting the professional take more frequent short breaks without altering their shift schedule. Explanation: this scenario presents a professional challenge because implementing workplace accommodations requires balancing the individual needs of a healthcare professional with a disability against the operational demands and safety standards of a healthcare setting. A DHP must navigate potential resistance from management, ensure the accommodation is effective and sustainable, and maintain patient care quality. The core of the challenge lies in translating general principles of ergonomics, modified equipment, and flexible schedules into practical, evidence-based solutions that comply with relevant disability legislation and ethical obligations. The correct approach involves a collaborative and individualized assessment process. This means actively engaging with the healthcare professional to understand their specific functional limitations and the impact on their work. It requires researching and recommending specific ergonomic adjustments, e.g., specialized seating, adjustable workstations, modified equipment, e.g., voice-activated software, ergonomic tools, or flexible scheduling options, e.g., adjusted shift times, modified break schedules that directly address the identified barriers. This approach is justified by the ethical duty of care to support the well-being and professional participation of individuals with disabilities, and by regulatory frameworks that mandate reasonable accommodations to prevent discrimination and promote equal opportunity. The focus is on creating a supportive and inclusive work environment that allows the professional to perform their duties effectively and safely. An incorrect approach would be to implement a generic, one-size-fits-all solution without a thorough individual assessment. For example, simply providing a standard ergonomic chair without understanding the specific postural needs or the nature of the tasks performed would likely be ineffective and fail to meet the requirements of reasonable accommodation. This approach is ethically flawed as it neglects the individual's unique circumstances and regulatory requirements, which emphasize personalized solutions. Another incorrect approach would be to dismiss the need for accommodation based on perceived operational difficulties without exploring all possible solutions. This demonstrates a failure to uphold the principles of non-discrimination and equal opportunity, potentially violating legal obligations to provide reasonable accommodations. Furthermore, implementing an accommodation without proper training or follow-up on its use would be a failure to ensure its effectiveness, leading to continued challenges for the professional and potentially compromising patient care. Professional decision-making in such situations should follow a structured process. 1. Conduct a comprehensive, individualized assessment of the professional's needs and the barriers they face. 2. Engage in open communication and collaboration with the professional to identify potential solutions. 3. Research and evaluate a range of ergonomic, equipment, and scheduling modifications. 4. Propose and implement the most effective and reasonable accommodation, ensuring they are tailored to the individual and the work environment. 5. Monitor the effectiveness of the accommodations and make adjustments as necessary. This process ensures that decisions are informed, ethical, and legally compliant, prioritizing the well-being of the professional and the integrity of patient care. Question 20. Governance review demonstrates that a patient with a mobility impairment has repeatedly expressed difficulty navigating the clinic's physical layout and accessing examination rooms. The patient reports that the current signage is unclear, and the waiting area seating is not conducive to their needs. The Disability Healthcare Professional, DHP, is tasked with addressing these concerns in accordance with the Rehabilitation Act of 1973. Which of the following represents the most appropriate course of action for the DHP? Option A. Implement minor cosmetic changes to the waiting area, such as rearranging existing furniture, without consulting the patient about their specific needs or assessing the effectiveness of these changes. Option B. Initiate a collaborative process with the patient to identify specific barriers and explore the implementation of reasonable accommodations, such as improved signage, accessible seating options, and potential modifications to room access, ensuring these do not fundamentally alter the clinic's services or impose an undue burden. Option C. Inform the patient that the clinic's current layout and signage are standard for all patients, and that no modifications can be made due to administrative policy. Option D. Suggest that the patient arrange for personal assistance to help them navigate the clinic and access services, as the clinic is not equipped to provide such individual support. Correct answer is B. Initiate a collaborative process with the patient to identify specific barriers and explore the implementation of reasonable accommodations, such as improved signage, accessible seating options, and potential modifications to room access, ensuring these do not fundamentally alter the clinic's services or impose an undue burden. Explanation: this scenario is professionally challenging because it requires a disability healthcare professional, DHP, to balance the immediate needs of a patient with the legal obligations imposed by the Rehabilitation Act of 1973, specifically Section 504, which prohibits discrimination on the basis of disability in programs receiving federal financial assistance. The DHP must ensure that reasonable accommodations are provided to enable the patient to access healthcare services without facing barriers, while also respecting the patient's autonomy and the professional judgment of the healthcare team. The core tension lies in identifying what constitutes a reasonable accommodation and ensuring its implementation is effective and non-discriminatory. The correct approach involves proactively identifying potential barriers to the patient's access to care due to their disability and engaging in an interactive process with the patient to determine and implement appropriate reasonable accommodations. This aligns directly with the spirit and letter of Section 504 of the Rehabilitation Act of 1973, which mandates that entities receiving federal funds must ensure that individuals with disabilities are not excluded from, denied the benefits of, or subjected to discrimination under any program or activity. The DHP's responsibility is to facilitate this access by making necessary modifications to policies, practices, or procedures, or by providing auxiliary aids and services, as long as these do not fundamentally alter the nature of the service or impose an undue burden. An incorrect approach would be to dismiss the patient's concerns about accessibility without a thorough assessment, citing existing protocols as sufficient. This fails to acknowledge the potential for those protocols to create barriers for individuals with disabilities and violates the non-discrimination mandate of Section 504. Another incorrect approach is to implement accommodations that are superficial or do not effectively address the patient's stated needs, which can lead to continued exclusion or unequal access to care, thereby contravening the requirement for effective accommodations. Finally, an approach that prioritizes administrative convenience over the patient's right to access services by refusing to explore or implement reasonable accommodations directly contradicts the purpose of the Rehabilitation Act. Professionals should employ a decision-making framework that begins with active listening and a non-judgmental stance towards the patient's reported challenges. This should be followed by a thorough assessment of the specific barriers presented by the disability in the context of the healthcare service. The next step involves consulting relevant policies and procedures, but critically, evaluating them for potential discriminatory impact. The core of the decision-making process is engaging in an interactive dialogue with the patient to identify and agree upon reasonable accommodations, documenting this process and the agreed-upon accommodations, and ensuring their effective implementation and follow-up. This systematic approach ensures compliance with legal requirements and upholds ethical obligations to provide equitable care.